What do you think about getting healthy adults checked for diseases? They are not sick, they don't have any symptoms, we just want to check. Well, it is called screening in medicine. Some people are for it, others are against it. Those that are against it say something is usually found. And when that happens, it increases their fear and heightens their anxiety. And they feel they are better off not knowing. Well, I don't blame them. There is a concept in medicine that is called overdiagnosis. Overdiagnosis means that healthy adults are subjected to tests and you find something in them that wouldn't have killed them in their lifetime. But because you have found something, then you want to subject them to further testing. Sometimes these tests are invasive and you might require them to, get some treatment with side effects. And then they are psychologically affected. They spend a lot of money seeking help for something that would not have killed them. And that is the reason some people have said, no, they don't want to know. Does it now mean that because of overdiagnosis, we should stop getting screened? No, not at all. There is a need to strike a balance between overdiagnosis and screening because screening can indeed save lives. And in this video, that's what I'll be doing. I'll be telling you adults that need to be screened and for what? By their gender, by their age, and by their family history. And those that may not be bothered. Please watch this video until the end so that you can actually be well informed. Now let's get into it. Number one is blood pressure. Every adult should get screened for blood pressure once in a year from age 18 and above. In the past, high blood pressure was a problem in older people, people from 40 years and above. But now, there is a new trend that we have observed hypertension in the young, people in their early 20s, they're having high blood pressure. The reason is not far fetched, it is about the way they live their lives. However, um, that is not a discussion for today, it is for another day. So, as a parent, please encourage your young adults to go and get their blood pressure checked. And as parents, please check also. But if there is a family history of hypertension or you are obese or overweight, then be sure to check it more frequently, maybe twice in a year. Number two is blood glucose. Blood sugar should be checked once every 3 years from age 40. But if you have obesity, overweight, or family history of diabetes, you will be checking more frequently or as advised by your doctor. Sometimes a person might have had high blood glucose that is not in the diabetic range, maybe pre-diabetes. That person will not be checking once in 3 years. You will exit the group that will be checking once in 3 years. You will check your own more frequently as advised by your doctor. The third is cholesterol check. People should start checking their cholesterol once in 5 years from age 45. However, if there is a family history of sudden death or early deaths, then people should start checking from age 20. If we know and do something about it, it can help to prevent heart attack, stroke, and other complications that are associated with sudden death. Number four is body mass index. Body mass index is the distribution of our weight across our height. So you can do it at home by yourself and you can do it every year. You can do it anytime you feel that you are adding weight. How is it calculated? If your weight is 50 kg, for example, and your height is 1.5 meters, then you will calculate it as 50 kg on top, 1.5 times 1.5 meters down. That is how to calculate it. If you get 18.5 to 24.9, you are normal weight. If you get 25 to 29.9, you are overweight. And if you get 30 and above, you are obese. You should change your lifestyle if you are overweight or obese. You should do more exercise and you should be more active. You may also want to see a doctor for more advice. Number five is colorectal cancer screening from age 45, once in 10 years with colonoscopy. If there is a family history of colorectal cancer, it should be started earlier at age 40. See a doctor if you have a family history so you can get started at age 40. The next is exclusive for men, prostate cancer screening for men with prostate specific antigen, PSA. That is a test. It is done every year from age 50. But if there is a family history of prostate cancer, then start from age 40 to 45. The next is cancer screening in women, cervical and breast. For cervical cancer, women between the ages of 21 and 65 should be screened with pap smear once in 3 years. However, if you are combining pap smear with human papilloma virus test, then it is once in 5 years. But if your tests have always been good, then beyond age 65, there is no need for testing. Breast cancer screening should be done with mammogram once in a year from age 40. Mammogram is not recommended for people less than age 40 unless there is a strong family history of breast cancer and your doctor has specifically requested. Otherwise, it is not recommended for people less than 40 years. It is a waste of time and resources in them. The last is dental check. Everybody should visit their dentist to get a dental check once or twice in a year. Go and check your teeth. Every adult should please do screening. It can save lives. And if something is found, then it is not a problem. Listen to what your doctor has to say. Seek a second opinion if you are doubting whether what he said is correct or not. Seek a second or even a third opinion. It is allowed. But where does overdiagnosis come in? Overdiagnosis comes in when we want to screen people who are 75 years and older for cancer. They don't need to be screened for cancer. Cancer screening is contraindicated when the life expectancy is less than 10 years. That is why you should not screen anybody 75 years and older for cancer. And so it is with women who have been doing their pap smear and it has always been good. You don't need to screen them for cervical cancer any longer unless they had a suspicious result in their previous test. In that case, your doctor may advise that you should continue. So a quick recap, blood pressure should be checked once in a year, blood sugar once in 3 years, blood cholesterol once in 5 years, BMI once in a year, colorectal cancer screening once in 10 years, prostate cancer screening once every year, cervical cancer screening once in 3 years, breast cancer screening once every year, dental screening once or twice every year. Thanks for watching. I hope you found it helpful. Please like it, share it with everybody. Everybody needs to see this. Then subscribe to the channel, turn on notifications, put your questions and your comments in the comment section or on the WhatsApp number showing on your screen. And do not forget, good health is great wealth. Let's do our part by getting screened today. At least before our next meeting, be sure to have checked your blood pressure if you have not done any other thing. Thanks once again and bye for now.